Well. We are live. And today we are just doing what we call a normal chat with friends. And I want to encourage you that today is a wonderful day, the last month of February 28th. Today is a wonderful day, and I'm welcoming everyone to join me in this discussion. And I've posted my StreamYard link there. You can join. I just want to pin it so that everyone might be welcome to this wonderful chat. I love you guys and for the support you've been giving me throughout my videos, throughout the journey of YouTube. And I'm very grateful that you have been supporting me well. And today is a very wonderful day that we want just to welcome people to this live vlog. And as I'm doing some setup, I want you to be asking any question related to what is disturbing you medically. And I will really appreciate if you do that. So on top of my link, I'm trying to do some setup. And if this goes well, we'll be able to, it doesn't play, we'll be able to continue with the live blog. So welcome guys to this wonderful location. And I'm seeing ST. Can I add you to the stream? Oh my guy,
Not yet. Relax. I'm okay.
Welcome to PAMLI Vlogs.
Thank you.
And feel free. Can you increase your volume?
No, I'm somewhere.
I'm still not getting you well, eh?
Let me get a place and then
I'm still not getting you well. Can you increase your volume so that we can chat?
I'm saying.
Yeah.
Let me get a place. I am getting you.
Yeah.
I'm getting you.
Let me increase my. I don't know whether my volume is what is up. Georgine, is this thing working? Volume, yeah. Is it working? Is it 100%? Hello?
Yeah.
Are you getting me?
I'm getting you.
You are not.
I'm getting you. Let me.
Okay, let me increase the volume here this side so that I can hear you well. I cannot get you. And if I get you, we can chat well. Let me increase some volume here. Just a minute. Oh. Okay. The guy was not getting me well, and I'm very sorry for that. And there's a StreamYard link up there. You can join me in the discussion of today. Okay. The guy was not getting me well, but my volume was still down. But I want you to join this discussion of today, and we want to talk about some good stuffs that I have here. Some big books. These ones. I have very many things that we want to discuss today, including the famous series that I'm doing. And this famous series is very wonderful. So if you join me in this discussion, I will really appreciate your channel if you have a YouTube channel, we can invite you to the screen, and you may continue. ST, you are lost, but I'm okay. I will invite you again. Just click the link on StreamYard and you will be invited in the screen so that you can chat with guys. We want to do this the whole day. We are here. We are not going anywhere. So let me just sit well so that we continue vlogging. Now, I want to invite some people here to join me. So just a minute. Okay. So that they can join me in the discussion. I love this, my guys. They are my group members. And I normally like inviting them live. So sending via my phone, join me, and it's done. It's done. So if at all you are within, there's a StreamYard link, and also there's a YouTube link that I've sent through the groups, and I want you to join me. Okay, the link has been sent and we are now live and ready to start discussion. We are waiting for some quorum. So after this quorum, we'll be able to start well. So my guys, welcome to PAMLI Vlogs, and the discussion is going to be lit. So make sure that you are with me. Apart from this, we are going to do very many things today. So guys, the network is lit. The network is wow. And the plans are also here. This is my plan. Very big book. You can see PAMLI Vlog plan. And those are plans that we have, videos that we are going to make this month of March. In fact, for now, I have 17 on the line that we are waiting for people to join and we start this wonderful discussion. So, welcome again, my people. And as I told you early, today we don't have a specific title of the topic. We are just talking. We are just talking. Then, if you want to join me live, let me just send this one to guys and tell them to join me live. Yeah. So, want somebody who can be supporting this channel as I do some setups. I'll be very happy if you are one of them who can join us through the discussion of today. So join. This is live. Join. This is live. So let me. ST, you are back. ST, you are back. Let me try to do this. Okay. Where are you, ST? Your channel is buffering. Your net is buffering. I'm trying to add you, but you are unaddable. So please make sure that your camera is on and no background music, because we do not want to get striked. So I will invite you again. So I will invite ST again, because I'm seeing him in the background, but he's not able to join, simply because maybe his camera is not good, his volume was not going through. So I want you people to join so that we can start discussing. So I'm going to give you some few minutes as I do some setup, then coming back. Stay tuned. You know, this one is not going, eh? Haichezangi live. Florence haichezangi live. Then there's a night. Yeah, we are still going on with the discussion, but still waiting for some quorum. Continue staying in the channel. Continue staying. Don't go away. Don't go away. Don't go away. We are still together, guys. We are still together. Don't go away. Don't go away. I'm still doing some setup. And after this setup, we'll continue with this discussion till the end of this day. So stay tuned. And if you have not subscribed to PAMLI Vlogs, there's a red button there written subscribe. Press it very hard. Turn it on, even the notification, so that each and every video I post, you will get. And I'm greeting everyone, including those who are in the pharmacy, those who are in the cash department, those who are in OPD. Welcome to PAMLI Vlogs, and do not go away. I'm still coming back, doing some settings. Well. I'm back. And Top Life, good morning. Good morning, Top Life. And I'm very happy that you are with me. Good morning. Good, good. Top Life, good. I'm back, and I'm very happy that you people are with me. And I would like you people to join me until the end of this day. That now I'm seeing 5 on the screen, and we want to start chatting away, chatting with people. And I said that there is a StreamYard link below here. There's a StreamYard link. Just click that link, and we'll bring you in the screen, and we'll start uh, chatting well. It's very nice if we chat with people. I'm seeing 11 people online, and I would like Omaya guys, thank you so much. Um, Join the chat and let's talk live. And there's a Streamlabs link. I'm happy you are here. I don't have a specific topic that I'm discussing today. Just to do our thing, the watch time issue. I'm soon clicking it. So I want you people to join me and help me to achieve this. And I can see Top Life in the Top Life is watching, or Maya Gas is watching, and I'm very happy for the support that you people have given me. Yes, kindly give the video thumbs up. Give the video thumbs up. Give the video thumbs up. I'm very happy about that. And this is very important to me. If you give the video thumbs up, also share with people in different groups so that the discussion can be very encouraging. So I'm still inviting guys. I'm still inviting guys. These guys that I'm inviting here, I want them to join me live so that we continue with this discussion. We continue with this discussion very well live. So I've sent it to very many groups so that people can join me and assist me in this particular discussion. No specific. I want people to ask questions. I want people to join me, and we discuss very many issues that are affecting our lives in terms of medicine. And I will be happy if this discussion goes watching from background. I'm at work. Thumbs up so much. Just put it on background and let it roll, because this is very helpful for YouTubers. We need that watch time, and we need interactions. Christina Flourishing, hello, good morning from my side. I'm leaving you running. Oh, pray for me, pray for me. I was doing night duty, and I've decided just to end this year, and not year, this month. Sorry, to end this month by just chatting with my fellow YouTubers and my fellow viewers. So, Christina Flourishing, Omayagas is in the mix. If you have not connected with Omayagas, that is what we do. Connect. Top Life is also in the has joined us. Kindly connect with Top Life so that more subscribers to increase. So, Akicho, thank you so much, my dear friend. I hope uh, you are there. No background music, and you are in. Now you can greet me. How are you, Doc? I'm seeing you. Can you say something?
I'm good, Doctor.
Good friend. I can see you
I'm
in the
good,
screen, but now
Doctor.
You are freezing. You are freezing. You are freezing. You are not talking. Can you re-enter again? Let me try to enter you again. My dear friend is not. I can see you in the background, but now you are not able to say anything. My friend Eric is in the group and he has joined us. Georgine, oh, welcome, welcome. Let me post this. Nice, bro. Thank you, Georgine. And also Christina Florizing. This is good. I'm trying to add a Kicho, but a Kicho is not going on through. Let's support me. Support me by support me. So if you want to join, just click the StreamYard link. I will see you and bring you to the screen. That's what I've posted there. That is the StreamYard link. You just click that link and I will bring you to the screen and say hi to people. Top Life, good morning. Thank you so much. And Omaya Girls also, hi Doc. Thank you so much, Omaya Girls, for joining. And also Christina Florizin, I know, kindly pray for me as you go to church, and thank you for running me background. Also, Georgine, so nice, bro. Welcome to the party. Welcome to the party. Mr. Onditi, I'm welcoming you in shortly. No background music. You can say something. Karibu. I'm now seeing you. I'm very fine. How are you doing?
No, fine, bro.
You are very fine, eh? We are also keeping this, and thank you for coming and for your support. And may God bless you. And if you want to say something for people, you can say something so that, yes, karibu sana, karibu sana. Okay, let me bring somebody here. Dwinkan, good work, brother. Dwinkan from Bay County Referral Hospital, the main lab. Karibu sana, bro, to the channel. Mr. Unditi is here, and you can, as you can see, he's also with us. He's also with us supporting this channel, and we are very, very happy for him coming. And you people can comment. If you comment, I can pin your comments in the screen, starting with guys that have commented. So every comment that appears here, like Omaga says thumbs up, we'll just pin it. And so, Mr. DT, do you have anything to say?
I'm just new to the channel, so probably I prefer maybe you tell me why the reason for coming up with this channel, and maybe from there I'll develop some interest. Yes.
Okay. Thank you so much, brother. Your volume was a bit, I don't know whether you reduced your volume to 0. So you've not heard what you've said.
Don't worry, I'm just too scared of Corona. So
So PAMLI Vlogs is a YouTube channel that was created. I joined. If you have your email account, automatically YouTube will recognize the day you joined. But let me greet someone here. Accord TV. Thank you so much for joining PAMLI Vlogs. I really love what you do. I really love your channel. I really love your support. And thank you so much for joining us. Kindly, if you want to say something, you can click the StreamYard link. We'll bring you in the screen. And this will be very, very vital for us. So I was talking about what Mr. Makonditi has said, and I'm still welcoming people. So PAMLI Vlogs, I joined, I created this link. I joined the Gmail 2011. and automatically, if you check about of my channel, you will see joined YouTube 2011. But I started vlogging 2019. I was just posting videos. I was not even serious.
You are warming up.
I was just warming up. I was warming up. So by mid 2019, I started watching a lot of YouTube videos, and I got interested in making videos. So I was a random vlogger, not choosing any specific niche. But late 2019, I narrowed down to posting some medical videos, and now that is what I do. Sometimes if I stream live like this, um, we normally chat with YouTubers, but sometimes I choose a specific medical discussion, and we normally discuss with people. So PAMLI Vlogs is about medical videos and weight loss solutions videos. I have videos that are targeting people who want belly fat. I've talked about a very nice drink that I love. It's called apple cider vinegar. If you want to burn your belly fat, you can check that channel. There's a video I did of cucumber juice as a fat burner. I also did a very nice video of amazing fruits that you can use to burn belly fat. Also amazing food for us men for erectile dysfunction. So it was a very wonderful video. Also in my videos, I discuss majorly gynecological problems that affect our women in the society, majorly reproductive health, even men. I've talked about erectile dysfunctions, and I've talked about there's this drug that people normally abuse, the Viagra, the side effects, contraindications. If you check my channel, you will see a video titled Viagra and its side effects. So, men, check that video and do not abuse Viagra. Do not abuse Viagra. Somebody is calling me now, but I don't want to receive any call because of strike. So I will talk to that guy later. Thank you so much, Makonditi, for joining us. And this is very important to us in terms of discussions. Thanks so much. So all guys that have joined me, I'm very happy because if you join and you ask me any question, I will be gladly reply. And while replying this, I will be talking, or if you want to know, let me just say, just PAMLI Vlogs Management, that is what is managing this channel. Thank you so much for people who looks like you are at work. Yes. Oh, Ako TV, I was doing my night duty, and I've cleared my duty today, and I've cleared mine. I'm remaining with one night so that I go for 7 days night off. So I've just decided to end this day, the 28th of February, by vlogging and talking to people, telling people about PAMLI Vlogs, replying to anything that anybody can ask, and even pinning. Kelly, thank you so much. Vincent Kelly, asante kwa kunikaribisha nyumbani. Thank you so much. Welcome. If you've joined us now, you can click that StreamYard link and make sure there is no background music. There is no noise, because background music can give us strike, and strike can take your YouTube channel down. So make sure that if you want to join me, there is no background music. That's my friend. We are at work. I'm just joining this. So to answer Akot asked me something. I was on night duty, and I've just cleared my night duty. I'm remaining with my one night duty. So bado niko hospitali. So I just decided to vlog this. We have fast internet, and that's why I'm doing. Normally, if you can see my video, if I try to go live, the video is not coming up well, and I normally disappoint my fans when I go live. But today, I've decided, let me do it here, where we have internet cables and fast speed 4G internet that will not buffer. So thank you so much. I'm still welcoming Vincent. It's a new guy. Make sure you subscribe to PAMLI Vlogs, share the video, share this live stream so that people can join, and also hit the red button written subscribe, turn the notification bell on so that anytime I post any video, you will be able to uh, get that video that I'm talking about. Just like I've told you, we are reviewing, and I've talked about this book from season 1, season 2, season 3, and season 4. In fact, my last was yesterday, season 5. Season 5. Somebody's trying to go and will give me strike. That is the song of Baba. Hello? Hello? Those guys who are impatient now, that's our man. But I'm very grateful will you respond. Next time, tafanya vizuri. Okay. Thank you so much. Thank you, Akot, for contributing. That's a fellow colleague was inquiring sometime. Let's discuss this. I know a girl who tends to have little bumps appearing on her legs, though it was allergy or something. She is now 16, and those things keep coming on in a while, and she doesn't even go for treatments. That will, what will you advise in this case? Thank you so much, Akot, for bringing this discussion. So I know a girl who tends to have bumps appearing on her legs. So if I may ask, is it in front of her legs or back in her legs? Because there are conditions that normally affect your calf muscles, that's the back of your legs, and there are some conditions that can just affect the general skin of your leg. So if you can tell me which part of the leg, is it in front or back? So let me just assume it's an open question. We have what we call varicose veins that normally appear. It can appear on the back of your thighs, towards your calf muscles, towards your lower limbs, which is a problem of the veins. So this particular lady should come to the facility so that or any hospital that is nearby so that we can verify and know which kind of these bumps you are talking about, or cause allergic reactions. If somebody is scratching because of that allergy or itchiness, it can swell and leave a swelling called keloid, and this one can be so disturbing to ladies. So if this particular patient can come and we do our physical exam, then we will be able to give the way forward, and not necessarily coming to where I work, but going to any hospital where she can be examined and be treated so that we know whether this is a keloid or this is allergy that is due to what I've said earlier, or these are varicose veins, or these are what we call lipomas, swellings that normally occurs in the skin. So kindly outline the best way possible to manage high blood pressure in adults. Okay, I'm coming for that. Let me welcome this, my friend, Mwendo Kasi. Mwendo Kasi, how are you, my dear friend? Thank you so much for joining us, and I'm very grateful. And we are just discussing, and I'm I want to discuss what kindly outline the best way possible to manage high blood pressure in adults. Thank you so much, Akot, for bringing this. Now let me just sit well because the discussion has just kicked on. Yes, hypertension or high blood pressure. Let me start by thanking Akot TV for this particular question, and we want to discuss this management of high blood pressure in adults. And we are going to categorize this in terms of what is high blood pressure, how can you know that you have high blood pressure, and what can you do to reduce this high blood pressure. Now, when your pressure, when you go to the hospital, what normally takes patient to the hospitals are the signs and symptoms that they exhibit. In this particular discussion per se of high blood pressure, someone will start developing headache and general body tiredness and sometimes blood visions. If you are starting to develop blood vision, that means the blood pressure is very, very high. So it normally present like common conditions, maybe like malaria, like typhoid, but with the cough, if it proceeds to what we call congestive cardiac failure, now that complications of high blood pressure that we'll talk about. Now, in high blood pressure, if you come to the hospital, we will take your blood pressure with what we call blood pressure machine in normal layman's. We have different types of blood pressure machines. We have manometer, we have a digital blood pressure machine. So when we take your blood pressure, the cutoff point is we have what we call systolic and diastolic blood pressure. So let me just use normal layman's language, the upper one and the downer one. So we are still discussing this. The upper one should not be passing 140. The lower one should not be passing 90. So let me say denominator and numerator. 140 over 90. We should start querying that this one can be hypertension. There's also pre-hypertension that is clearly going towards 140 over 190. Now, if you click 140, 190, that is on the cutoff point. We may not initiate treatment. We may try to find out why you have this kind of signs and symptoms to rule out other causes of those symptoms and signs you presented with. Now, if we get that your pressure is going past 150 over 120 or 100 over 120 or 150 over 160, then we may start initiating you with some drugs just to relieve you from what you are experiencing. And of course, we'll give you some times after taking your blood pressure, because what normally exacerbate blood pressure is new environment, anxiety. You can come to the hospital, you fear. Maybe you came for a specific test, you fear that this test might be positive, and that anxiety can exacerbate your pressure, but you are not hypertensive. So when we have decided to take your blood pressure and we get that after doing your blood pressure, it is 140/90, that is the minimum side. After 1 hour or 2 hours of observing you, it is still there, 140/90, or it has increased to 150 or 100, 150 over 100, or it is persistent after maybe giving you a drug called Adalat. We put it under the tongue. After giving you this sublingual Adalat, we still find that your pressure is still above 140/90. Then, of course, now we will initiate treatment. So treatment, there are some supportive management and specific management. Now, before even we prescribe drugs that you are going to use, we should be able to know what is your sugar, blood sugar. Your blood sugar, diabetes is related to hypertension. We'll send you to the lab, we'll do your blood sugar, we'll do your urea, creatinine, and electrolytes to verify how your kidneys are functioning. Also, we'll do full physical, full medical history and physical exam to elicit what might have caused this your high blood pressure. And you know, it is documented in Davidson's that 90% of causes of hypertension is not known. The known ones are lifestyle diseases. People say if a woman goes through vasectomy, oh, I will talk about that. Anyway, correct that. Women do not go for vasectomy. Only men go for vasectomy. Women go for tubal ligation. We'll rectify that. Accord TV. Thank you so much. Now, we're still discussing this hypertension. So from the lab, we'll be able to know why, what is causing this your pressure. If it's due to diabetes, we'll manage diabetes with this your pressure. Of course, there are specific drugs that we may not prescribe online, but there are different types of classes of antihypertensives that we normally give patients presenting also in relation to what is happening to that patient. Of course, we'll give psychological counseling because people, if they hear that I have hypertension, then their pressure will be aggravated other than what was happening to him or to her. Of course, also I talked about preeclampsia or eclampsia, that is hypertension in pregnancy. We'll be also able to take care of that. So management of hypertension is consisting of counseling, laboratory investigation, and of course now the drugs per se. In counseling, we'll also tell you the type of food you will eat because obesity is also closer to hypertension. We'll be able to know your body mass index. If you are obese, we'll counsel you the type of foods you are able to eat, the ones you are able to avoid. It will encourage you to do physical exercise. So that is all about that. If at all you have a question, you can add. Now, there's something here which is more nice. People say that if a woman goes through vasectomy or it's tube, something for women, I've forgotten the name. It is called bilateral tubal ligation, that is BTL. Now, if a woman goes through it for family planning, does this affect her sex life? Thank you so much, Ecot TV. We are just going to ligate the tubes and then tie them. It doesn't affect sex life. In fact, that is one of the common questions that normally arise during when we meet guys from the guys from Mario Stokes. They normally come to the facility, different facilities in Oba Bay County. We give a schedule with them and they do this tubal allegation or even a planned one that mostly they come for women, but planned for men, they do in their facility. Now, this one does not affect your libido. That's what we call low sex drive. Of course, we know that when a woman is having what we call the normal physiological process that occurs due to menstruation, ovulation, there are hormones, progesterone and estrogen that normally help to regulate this mood. Sometimes the moods can go down and mostly it's psychological. So sex life, no, it doesn't. Even if it was interfering with the sex life, most people would avoid bilateral tubal ligation for women. And men, it doesn't affect erection. That is what we call vasectomy. Vasectomy does not affect erection. And again, Kot is saying something here. And again, after vasectomy or something, a woman is supposed to be getting periods as usual or not. Vasectomy is for men, as I've said. Vasectomy is for men, as I've said earlier. It's not for women. Not for women. It's not for women. Now, thank you so much, Apple TV, for bringing this kind of topic, and I'm welcoming somebody here, and I want, let me just text. Okay, so let's still continue with the discussion, and I think what Akot has brought on board is very, very important, because these are common conditions that normally affect people in the society. And of course, when you are deciding on a mode, now that the topic has arisen, if you are deciding on a mode of family planning, uh, supposed to stillbirth. If we've done tubal ligation, it will depend. There's unilateral tubal ligation, may be due to a condition that a patient has exhibit with, or bilateral tubal ligation, meaning all the tubes will be ligated, or let me say cut and tied. You will not be able to conceive, because this is a permanent family planning method. So, oh, you said what causes stillbirth? Oh, okay. Oh, sorry, I didn't read that. I thought you were saying, can it result to stillbirth? Now, let me just come back to this. Stillbirth is death intrauterine, death that normally occur. And in this facility, we normally meet different cases of stillbirth, and it normally gives ladies a lot of psychological trauma. Stillbirth can be affected by the following conditions: environmental, maternal factors, and fetal factors. Fetal factors sometimes is not, we will not be able to identify the fetal factors, but what is on the ground is that I talked about rhesus isoimmunization. That one, if a woman has a rhesus negative blood giving birth to a rhesus positive blood, subsequent pregnancies, rhesus isoimmunization can result into stillbirth intrauterine. Also, pelvic inflammatory diseases that goes untreated can result into stillbirth intrauterine, meaning fetus may die in the uterus. Also, when there is trauma, if somebody has kicked your abdomen or somebody has kicked your belly, it can result into intrauterine death or death in the uterus, and this one can bring what we call stillbirth, giving birth to a fetus that is already dead. And also, there are drugs that should not be used during pregnancy. These drugs are given category X. Category X. If you swallow these particular drugs, they can cause intrauterine fetal demise, the death of the fetus. So that's why we encourage that if you are coming to the facility, if you are sick and you suspect you are pregnant, kindly do not just take medicine that you do not know. Let clinicians, doctors, and nurses advise you accordingly. And also, when a woman takes excess herbal medication, we normally experience this, and this normally occurs to those who normally attend traditional birth attendants. They take excess herbal, and when they come to the hospital and you try to use your fetoscope to verify the fetal heart rate, and also eventually taking this patient to ultrasound, you will get that there is no sign of life. So those are one of the causes of um, intrauterine fetal demise or stillbirth. And again, there are some genetical factors also that might affect the fetus intrauterine and kill the fetus and cause what we call stillbirth. And then Scott is bringing things well here. And again, okay, this one we have discussed. Uh, this one was stillbirth. Okay. How safe is Viagra for men and is medically recommended? Wow, 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 wow. I started by saying this. Now, Viagra is causing too much wave in Kenyan society. In introducing this, I've talked about Viagra side effects, cautions when you are using this particular drug. How safe is Vega? Vega is very safe. It's very safe because there's a reason why we prescribe it. The only issue that come around is that people who normally abuse this particular drug, they want to show their sexual prowess. They want to prove to the other gender their manhood and how they can be mighty. Yes, they want to be feeling strong and to maintain this particular lady. But now, back to your question, Ako TV. How safe is Vega? Vega is very, very safe. In that my video, I talked about conditions that may exacerbate you developing heart attack when you use Vega and eventually die, particularly when you have hypertension, when you have diabetes, when you have heart diseases, cardiomyopathies, any disease affecting the heart and liver or even kidney. If you use Viagra, it might exacerbate this. Now, we only use Viagra for two main conditions. One, the popular one we know, erectile dysfunction. And also the second one for people who have what we call arterial hypertension. So sometimes you might get a lady is taking Viagra daily, and you may wonder, why is this lady taking Viagra? It means that she has been diagnosed with arterial hypertension and is taking that Viagra. Now, the reason why we do not want this drug to be prescribed, by the way, Vega is a POM, Silvio. It should be prescribed, prescription only medicine. So it should be able to be prescribed, and you should be having a prescription if you go to the pharmacy. But the only problem is that us, we just go buy it over the counter. Maybe due to several factors, we want to prove to people those are sexual prowesses. Now, this drug is very safe, and if you come to the hospital, what we'll do is to take you through a series of questions and a series of tests and a series of counseling so that we may know whether erectile dysfunction you have, is it psychological or medical? Because most young men, erectile dysfunction is psychological. You feel that I'm not going to perform. And if you have that in mind, you will not perform. So, yes, I'm presenting a very important topic. Yes, Karibu. Now, when you want to use Viagra, kindly come to the hospital. We will do your blood pressure, we will check your sugars, we will verify that you have no any other medical problem. Now, if you use Viagra, if you are hypertensive, it will exacerbate this your condition and you will develop heart attack and you will die instantly. And that's why most people are reported to have died with their sweethearts in the hotels or in the place or in the lodgings, if I may say so. So, and this one is very, very embarrassing, particularly to men who cheat. So, when you want to use this drug, kindly make sure it's prescribed and there is a reason. So, to answer Akot TV, how safe is Viagra for men and is it medically recommended? Yes, Viagra is very, very safe for men. It is medically recommended in two particular conditions, that is arterial hypertension and men who have erectile dysfunction. Thank you so much for bringing that wonderful topic. And please kindly watch that my video about erectile dysfunction, about Viagra, and also watch amazing fruits for erectile dysfunction. Thank you so much, Ako TV, and let's continue. Let's check whether somebody has asked any questions so that we may continue with the discussion. So I'm very, very happy for people who have joined, and we are doing 1 hour strong. And as I said today, I will talk the whole day, the whole day. So anybody who has any question, and let me see where people. Oh, let me greet this before this. My good friend that she knows why I'm doing this. Hey guys, bucket list says, ask any question. Ask PAMLI Vlogs, and PAMLI Vlogs will try his best to answer. Is the best of my knowledge to answer you on this. So, I'm welcoming bucket list says in this discussion of today, and I'm very happy to have you. And Akot has been really well in this my channel today, bombarding me with questions and keeping the discussion alive. Thank you so much, bucket list, for coming. And let's continue with this one. People are always encouraged to donate blood. How safe is that to the donor? And how many times should one safely donate blood in their lifetime? Wow, wow, wow. This is very, very nice. We are starting to discuss blood donation, blood donation, blood donation. Now, donating blood. It is very, very important to note that long time ago, people could donate blood and you are transfused with that same blood after donation. So people are encouraged to donate blood. Yes, we encourage people to donate blood. Even as per now, we are in a crisis of blood. It is safe to donate blood, yes, but now before this blood is issued, this blood must be taken back to the central place where bloods are screened and stored for at least a period of 3 months. So if you donate blood today, we are in Feb. It will take around 3 months for this blood to be released to another donor. The reason why we are doing this is because we want to make sure that the blood that you are receiving has no any other medical or genetical condition. Now, if you donate blood, the common things that we will be able to think of is, do you have HIV? Even if a patient is HIV negative, if it is HIV positive, she can't be given a blood from a patient who is HIV positive. So this blood must be screened for HIV. This blood must be screened for hepatitis or even genetical disorders like sickle cell, beta thalassemias, leukemias. This blood must be screened. And when we screen this blood, we want to make sure that the donor is safe in terms of how many bags are you able to donate at a go. Mostly some people come, I can give 3 pints of, 1 pint is 500, 450, 500 mils. Mostly they are 450 mils. If you donate 2, that is around going towards almost 1 liter. You can donate 2 at a time, but past 3, you can develop what we call hypertension, and you might even die when you are donating. And there's a age group that should not donate. One, those who are pregnant and breastfeeding, no donation. Children under 5 years, don't donate. How many times should one safely donate blood in their lifetime? According to donation of blood, first of all, we should be having a history of have you ever donated. Like me, my blood group is AB. I've donated almost 4 times in my lifetime. This one will depend on your blood level. You can even donate 5, 6, 7 times if your hemoglobin level is good. But in a year, you should donate at least 3 times in a year. At least 3 times in a year. So in a lifetime will depend on your hemoglobin level, because blood hemoglobin normally take 120 days and they are destroyed and the new ones are made. So when you are donating blood, those are the factors that we keep into consideration. So what is a quote saying? What is saying? If you will start a foundation in the medical field, what will it be about? Okay. If I would like to start a foundation in medical field, what is it about? I talk about gender-based violence. People beating their wives and wife beating their husbands. That will be my number one. If I want to, if I want to start that foundation, I will be against men who are beating their wives. So bucket list now, number one is gender-based violence. Number two, should I proceed to number two? Only if you allow me. But number one, the foundation I would like to start is for gender-based violence. Let me welcome somebody. Margarita Oyaro, thank you so much, my dear, for coming to PAMLI Vlogs. We are just randomly asking questions and answering. If you have not connected, to those who have joined this, kindly connect. I have very many people. Let me start. Top Life joined us. Omaya Girls, Christiana Flourishing is a YouTuber. Akot TV in the mixed. Mwendokasi FM, Bucket List says, and now Margarita Oyaro. Welcome, Margarita. Thank you so much. And we are going on with the discussion. Accord, thank you so much. If somebody accidentally receives the wrong blood type, can there be help or it will become a fatal situation? Wow. Now, this is now laboratory. Doing Kanowino, are you live? Can you come and say something here before I proceed? Akot has asked a very important question, and I would like, if any lab person is in the mix, click the link here and join. But I'm still going to answer this question so that we don't keep our guests for long. Yes, I will answer number two shortly. Akot, the bucket list. Now, Akot, long time ago, when when people started receiving blood for transfusion, we were normally transfusing people without screening, and this was very, very fatal. The number one fear is transfusion reaction. Sometimes you can, okay, before I go that, there's a process until you follow, until this blood reaches the hand of the nurse. If blood, for example, in Home Bay County referral, we received our blood from the main blood bank in Kisumu. Those are bloods that have taken time, 3 months, they have been screened and they have been proved beyond no reason in doubt that they are safe for blood transfusion. Now, if they reach into the facility, one, we have the patient who is, let me say, at that accident is severely bleeding, and we have done the blood group, and maybe, let me use mine, I'm blood group AB. Blood group AB, I'm a universal recipient, meaning you are caught, you can give me blood. Let me use the word give me. You can donate blood for me. And anybody watching this can donate blood to me because I'm a universal recipient. If you have blood group O, You are universal donor. You give anybody in the world, anybody in the world. Other like A and B, A will donate to A and will donate to me. That is AB. B likewise to B and will also give A B. Now A will receive from A mwenyewe and O because O is cutting across. B will receive from B mwenyewe and O is cutting across. Mimi as AB, I will receive from anybody. So I'm safe. Now, if someone accidentally received the wrong blood, now it is very, very difficult in this current situation for somebody to receive a wrong blood. But we are human beings. There must be an error, or there might be an error during processing of blood. The laboratory technician will receive samples from the person who is supposed to be transfused. Let me say I'm supposed to be transfused. They will draw blood for me to check my level of hemoglobin. If they find that my hemoglobin level is less than 5, or I've bled because of an accident, God forbid, they will take my sample to the lab. What will they do with this medicine? They will take 2 samples, one in a red top container and one in a purple top container. Now, after taking this one in a purple top container, what will they do with this? What they will do is to do what we call cross-matching and compatibility test. They will cross-match and do compatibility. Cross-matching, they will be knowing, I can say my blood group is AB. The lab will not rely on the word of mouth. Only if I had a document. Even if I have a document that is showing that I'm blood group AB, they will still go ahead and cross-match and do compatibility test. Sometimes I can have a blood group A, B, and there's a blood in the bank AB, but compatibility test is not rhyming. I will not be transfused that blood. If I'm transfused that blood, it will be fatal, the way you say it. After doing this compatibility test and cross-matching, there are batch numbers in that particular blood back pocket. They will, if you come to collect the drug now, you are the nurse or you are the officer collecting the blood. You will verify, is this number the same as what is documented here? If they are the same and you verify, you will append your signature in that particular register where you collect your blood for transfusion. After appending the signature, you will carry this blood and hand over this blood to the nurse. Before the nurse transfuses this particular blood, she or he will also verify all particulars that in that blood bag versus what is in the document. And if all these things rhyme, they are the same. She has verified this beyond no reasonable doubt that these things are rhyming. She will take the patient's vital signs, that is temperature, respiratory rate, blood pressure, before transfusion. She will write the time of starting to transfuse and begin transfusion. In the first 5 minutes of transfusion, that is where most fatal reactions of blood during transfusion occur. She will stand there and watch. After 5 minutes, she will document the first 5 minutes, there was no reaction. Though we have late reaction which might manifest later. and some of the factors might not even be known why everything was done very well, and this will occur. Now, Dwin Kanowino, this is a senior laboratory technician. I wanted you to come online and answer this particular question that I got asked about blood transfusion. I hope you are hearing me. I hope you are not so busy. There's something I got asked here. Where is it? Have you? Hey, I got asked this. Dwinkan. If someone accidentally receives the wrong blood type, can they be helped or it becomes fatal situation? I've tried to explain the process of doing cross-matching and compatibility tests, and the process of taking that blood from the lab to the nurse via verification from the registers in the lab, and even verifications in the ward. And now the first 5 minutes of transfusion has started, and it has gone well. There's no reaction. There's no transfusion reaction, early transfusion reaction noted in the first 5 minutes, and we are continuing this blood. This blood will flow for 4 hours. Blood will flow for 4 hours. Dwinkan, you may come to the screen or you can answer via text. Now, let me invite this. Amor Lisa TV, thank you so much. And welcome. We are answering what Akot has asked, and it is very, very important in this discussion. Now, transfusion will go for 4 hours. After this 4 hours, there can be late transfusion reaction, and this can be occurring, and all those factors that I've said has been put on place, but we still have transfusion late reaction. Now, what will we do? We will go back from now the mess. What was the batch number? There were the numbers rhyming. Did you check the blood? Because sometimes blood might come, it has clotted. If the blood clots, you don't give it. If it clots in the heart, it will cause pulmonary embolism, and the patient might start reacting and die. So, what did she do? Did she notice anything wrong with the blood? We even take that blood back and go back with it to the laboratory for future and verification why this patient developed transfusion reaction. Of course, transfusion reactions normally occur. In this, your question, Echo TV, if someone accidentally received the wrong blood, of course we are human beings. This might happen. In medicine, we don't say it can never. It can happen. Now, your question, can they be helped? Listen to this. Immediately you start transfusion and you see the following: goose pimples. The body is developing a let me not use medical term. The body is developing, let me say, pimples. Sorry, it's a bad one. The body is developing pimple, the swellings. This patient is restless. The patient is sweating. If there is bleeding coming from the nose, from the mouth, even the eyes, that is a fatal transfusion reaction that you should start oxygen immediately. Introduce drugs. We have drugs, hydrocortisone. We have drugs that normally, why is this screen? We have drugs that normally stop bleeding, the vitamin K you inject, and you observe, you initiate fluid so that this patient will not die. We normally do this, and almost 98% cases normally survive, but some normally succumb because when transfusion reaction is very, very fatal, blood is coming out everywhere, all orifices, the nose, the mouth, the eyes, the ears, the ladies, the vagina, and sometimes within 5 minutes, the patient has lost blood, and there's no way you can rectify this. So to answer you, Akot, this is very, very possible. This is very, very possible to discuss to develop this kind of transfusion reaction. Now, thank you so much. I think if I've not answered anything well, kindly do that. And again, when a patient has developed transfusion reaction and we've done our best and the patient has recovered, then we will also monitor the process again of the next blood that we are given. So transfusion reaction can be early, intermediate, or even late. You can start transfusion the first 5 minutes, there's nothing happening. Within another 30 minutes, patients start developing restless, sweating, fever, bleeding. The very number one thing is stop that transfusion. And if you are a person who has a patient that is being transfused, and after the nurse has gone, after 5 minutes, there's nothing, and you see these ones happening, report to the nurse immediately. Of course, there are some mild transfusion reaction because of the body is receiving that the blood that was not its. Those are normal. We just observe and we allow the transfusion to proceed. But now you, with the patient, sitting with you as the caretaker, report anything that you see. We have witnessed over the years women giving birth and even children who are not theirs. God, do you think there is a way that nurses and doctors perhaps can be trained to avoid such mistakes? Good, good. This is good. If you watch a video, this is called, there's a video whereby children were exchanged during birth. Most of this secreto de amor video, this soap operas. I'm just forgetting the name. But there are two ladies who are exchanged during birth. And it brought very many issues and in that video. Now, this normally occurs in a facility where people deliver very many children at a go. You might have, for example, me, when I was doing my, let me sit well, when I was doing my rural experience and I was left alone with mothers. 4 were in labor. One is pushing this side, one is pushing this side, so I had to call for help. And in this time is whereby you can find that somebody is going with the wrong child. Why? Because that warmer that we normally put the children to, let me just use that layman language. After birth, there's somewhere cool we put our children to receive some warmth. That is the first place that confusion takes place. Now, this normally occur, and what I said, 1, it can occur accidentally. 2, it can be planned. 3, it can be due to the mother that has given birth. She doesn't want the sex that she has given birth. And particularly when she was looking for a male and she has given birth to a female. Or when she was looking for a female and she has given birth to a male. So these particular things normally occur. We are trained to do this. And all the hospitals, what normally happens that the babies have tags. If you have delivered kangaroo method that I was talking about, before even the baby is placed into your belly, you will be told female or male. You will answer male. And this also depends whether the patient, some do give birth and go off, we resuscitate later. So if your child is female, you've recognized your child is female, ideally this child should be tagged with your name. For example, if a woman giving birth, I'm PAMLI, then the tag should be, the child should have a tag called PAMLI in his or her wrist and handed over to the nurse that is taking care of children post delivery, because every facility has its own way of doing things. There are some facilities that you will deliver and you will see your child 4 hours later. There's a facilities that you will deliver and you are with the child. The child will hand it over to the relatives. So this confusion normally occur, but we are trained that we should be tagging this our children and handing over to the nurse that is in charge of those children. Or as some facilities normally do, you hand over to the nearest relative that came with the patient. And this is why we encourage all husbands. In my discussion about father support, the first season of Focus Antenatal Care, I talked about men involvement in this. If you are a man and you cannot be there during delivery, kindly send someone so that these issues that children are being exchanged, people losing their children. Of course, some do steal the children. That's why most of the facilities now we've installed CCTV that is 24/7 watching. If somebody does that, then that is now a criminal case that should be reported and investigation should be initiated very fast. So Accord TV, not forgetting that thing normally occurs. Join PAMLI Vlogs and let's continue chatting, and we may chat up to evening because I'm doing my night duty. Yes. No, I'm still live in vlog. If it's, I'm still live. Tell him I'm still presenting. I'm online, and she will wait, or we will wait. I'm still presenting. Yes. Any question that anyone will like to do? Bucket list. Cheers, everyone. We are in the same scenario, same situation. I'm leaving you running nilale kiasi after night shift. Yes, this is very important. Bucket list, and sleeping is very important. Today, me, I'm not going to sleep because I'm clearing my night shift. So I will have the whole week, the whole day to sleep 24 hours sleeping. So let's go back to now. Let me now review my videos, and if there's no question that is arising. Doc, can you block for me that thing? This guy's now. Lisa Amo, thank you so much. You are enjoying the discussion, and I'm very grateful for your involvement in this, and this is so much, and this is very wonderful for me. And I am just waiting for somebody to shoot questions, and let's continue. Now, I was so passionate about this book, and I brought it now live as one of my videos. If you check my channel, I've discussed cases in terms of this book, in terms of series, season 1, season 2, and season 3, 4, 5. The last discussion was season 5. And in this, there's a reason why I brought this book for discussion. And we want to avoid complications that normally occur to our mothers when they come to the facility. I've talked about father support, and this is very important, and I would like to brush through the videos on season 1, season 2, and season 3 in terms of discussing this particular book. In the father support, I was encouraging fathers in terms of preparedness, in terms of making sure that we be with our spouses from day 1 to day last, so that we may be able to know the situation that they are going through. We may support our wife both emotionally, physically, and even financially by buying things in prayer. In our Luo tradition, we normally discourage this, and I want to discourage my fellow Luo parents. Luos are softwares, but this is where you go wrong. Some normally do not want to be prepared in terms of buying babies material in prayer, simply because they say that you cannot start counting your chickens before they hatch the eggs, and this is a very archaic old way of reasoning, I want to give an example of what normally happens, what I've seen myself. A man comes to the hospital, they do not have anything because of this tradition. Gives birth, they don't have baby soul, they don't have anything to do with the baby. She goes to the market. Now, those women selling clothes, if they see a man wanting to buy a baby soul or baby clothes, they will triple the price. They will triple the price, my friend. Because one, they know you are desperate. They know you will buy. It is a must, it's mandatory. Even if you go to buy these basins, except now if you go to the supermarket, they will not exaggerate price. You will find that somebody is tripling you and telling you if you do not want, just go buy somewhere. And if they've noticed that this is what is key in your life, you will end up buying two clothes at 2,000, maybe buying a simple mutumba of 200 or 250. So planning family birth plan is very very important in relation to that, and that's why I encourage each and every one of us to help us through father's support. Yes, says us something about, yes, number two. Number two, I said first I go for gender-based violence, and number two, uh, I should be able to open an orphanage, take care of those children who are suffering, who do not have parents, who do not have fathers, so that they also enjoy what people are enjoying. Even during Christmas, there some do celebrate well, but they don't have flourishing. Thank you so much, and may God bless you for coming. So that is my second thought. My first thought was to buy. I was to start gender-based violence, and the second one is to start what we call orphanage. Now, let me attend to somebody here shortly. Anybody who is there, so that to join the screen to discuss with people. When I handle some friends here want something and I can't leave you. Omaya girls, you said you are going to play me background. That is so cool. Christina Florizing, I'm reviewing those who had joined me. That's so nice. You said that you are leaving and you are running me the background. Vincent Kelly, thank you so much for joining. Mwindo Kasi FM, thank you so much for coming. Ako TV has been very, very vital, throwing some very necessary questions, bombarding me with questions, together with bucket list from night shift. She's sleeping now. I'm very grateful. Margarita Oyaro, thank you so much for joining. Amorlisa TV, thank you so much for joining. And I'm very happy for the support. Christina Forsing and Dwayne Duncan Oweno, you did not answer my question. But now I'm very grateful that they have been answered and things are okay. So as we continue with the discussion, I'm very, very happy. And let's keep the discussion. Again, in antenatal danger signs during pregnancy, I talked about this, or danger signs during pregnancy. I told you I'm still reviewing this my video, and the topic of today is let's chat, and you join me, family vlogs, as we do chatting. I talked about danger signs in one of the videos, and I talked of very many issues during pregnancy. And those issues that I talked about, I want you to put them into consideration. We are just going to brush through them in relation to this. We talked about hypertension in pregnancy and signs and symptoms, the preeclampsia and the eclampsia and how they are presenting. Particularly if a woman has blood visions, has gastric pain, has severe headache, be able to come to the hospital. If the baby is not moving on the uterus, you should come to the facility. If you experience heavy bleeding, we talked about PPH and APH. Particularly in this scenario, I talked about antepartum hemorrhage in that video. Kindly watch that video so that you can enjoy what I was talking about. Even fever, I brushed and I talked about signs and symptoms, things that can result into a woman developing fever during pregnancy. And of course, in season 2, I talked about antenatal profile. All those profiles, all those screening we normally do for pregnant mothers, please kindly come. Do not wait till it is late, is when you are coming to the facility. Do not go to a TBA and develop complications there. We encourage everybody to give birth to those two, because in any complication, we can take you to cesarean section very fast and do that operation. So I'm very happy for those who joined me during my last live, and we talked about very many things. So in the video reviews, I'm going to leave you a bit and continue staying with me and not go. Just going to review something here and coming back. Muchas gracias. Coming back. Shortly. Hey, oh. Hey, He's talking with me. Network imelost. Yes. Okay, we are still on. We're still on. Some issues that I'm still tackling here a bit, and I want you people to continue staying and do not move. Do not move until we will clear this discussion. So if you are staying with me, if you are promoting this my channel, kindly promote it without going away, and we'll still come back and continue with the discussions that we were doing. And I'm very happy for the support that most of you have given me in terms of watching my videos and in terms of commenting. I'll be back. Now I'm back. I'm back. Let me just call this person. Hey. Yang mana Varicose? Apa dia nak tahu? Dia udah. Kemana kini kau ada setting de pasti di mana? Yang mana augmenting begini? Dia tu orang kalau diuruskan tadi kata event tidak. Teks dan gajinya nak bukan live. Yes, we are back. We are continuing with the discussion. Yes, Dr. Omolo. Welcome, my dear. Welcome, Dr. Omolo. You can click StreamYard and join. Judy Roth, Oyaore PAMLI Jakabao from Germany. Oh, thank you so much. Thank you so much, Judy, from Germany. And I'm very happy for you joining the discussion. And this one is my good friend from Germany. Can you come online so that we can discuss? Or you are so busy, yeah? I want you online so that we can see how we can move family vlogs to the next levels. I need those watchers from Germany, Bucket List from Germany, Judy Roth from Germany, and also Colin from Germany. Those are my good friends. Can you come online so that you support me in terms of joining this channel of today? My other system is misbehaving, and I want to rectify that and continue. Okay. Thank you so much, the 8 guys that are live, and I want this discussion to continue until Machatonga in Kijalu, until further notice. And for those who have been supporting family vlogs, thank you so much. The discussion was late, and we want to pick it from where we left. Anybody online that can initiate the class to begin again? We had a short break, and we want to continue until at the end of this day. If it's good, we should vlog for 5 hours. My last vlog was 6 hours, and the people contributed well, and I want you people to contribute to this in terms of contributions, asking questions about I'm here, no worry, man. Okay, thank you so much. Thank you so much. Shonshu so much. I don't know how we say thank you in German. Can I Google? Bush and shine. Okay. Thank you so much, and welcome. And I hope you will provide your support. You can even leave it playing background, I will really appreciate, because your help is always what is keeping us going. And give the discussion thumbs up, like the video, so that YouTube will really love the interaction of people. And I know sometimes it might be very difficult for some people to come online. What am I going to say? What am I going to say? So just to cover up what we have discussed, starting from the first person to come here was Top Life, and the second one was Omaya Girls, and I'm now mentioning them so that if at all you've not joined, if at all you have not connected with anyone, you can see um, their names on the screen and connect with them. After connecting with them, you leave a very constructive comment in their YouTube channels, and they will also join you, and we keep this discussion going. So Omaya Girls, if you have not connected with Omaya Girls, kindly do so. Christina Flourishing is she's in church now, but she has said that she has left me running background, and I'm very happy. If you have not connected with Christina Flourishing, you can do so. We also have Georgine Odhiambo, who doesn't have a YouTube channel, but is a very good contributor to my channel. I encourage him to open one of these days a good YouTube channel. He's a pharmacist by profession. He can tell us more about drugs. Dwayne Khan was also here. Dwayne Khan is a laboratory technician in Homa Bay County Teaching and Referral Hospital. You can connect with him, though he's not a YouTube guy. Akko TV, these are good supporters of PAMLI vlogs. Akko deals with the general stuff, but particularly immigration. If you want to migrate to any country, she's well at that. She knows the stuffs. You can contact PAMLI Vlogs Management. This is what is managing my channel. Thank you for continuing managing. And then Vincent Kelly, also welcome. Mwendo Kasi is also a YouTuber dealing with good stuff and current issues. Maria Citizen TV reviews. Kindly reduce the volume, nisipata strike. And then let's Bucket Recess in Germany, dealing with the stuffs in YouTube, different types of stuffs. Kindly connect to Bucket Recess. And again, Lisa Amor TV. I'm just counting those who joined me in my channel today, and I'm very happy. Kindly join Lisa Amor and Christina Flourishing. Duoke volume. Man, go me a strike. One of Uhuru Kenyatta huyo. Yeah. Christina Flourishing is also a YouTuber. This is my good pigeon lady from Nigeria. Hi! Let me speak some pigeon. Ogawu, welcome. Now go die today. Welcome. Now this what time na go kill me. Na try to reach watch time. And then last but not least, Judy Roth from Germany. Thank you so much for joining this channel. And I would like to tell you that if you want to be a guest, I'm inviting you again. And That is StreamYard link that I'm posting right now. Okay, copying, pasting, posting, and it is posted. Oh, there's an error. Okay, because I've interacted so much, this YouTube regarded it as a spam. But now check on check on the topmost #1 comment in this channel. There's a YouTube link. There's a link on concerning StreamYard. StreamYard is a very nice software online that we normally use while vlogging. You can get full review of it, and you can even pay for it to receive more features of StreamYard. So I'm waiting for any guests that will come around so that we can pin the guest around. And this is so good if you join me. And let's see the comments again. Okay, Maya girl says watching from background. I'm at work. Thank you so much, Maya girls, for considering family vlogs. As you can see, we have series of videos that are upcoming in the month of March, and my loyal subscribers, thank you so much. I will be expecting you a lot because we'll be interacting a lot in terms of those videos that I'm going to post. If you want to receive those my videos without any stress, just click the bell icon, turn it on, and this one will this one will redirect you in terms of notifications that you will receive every time we post any video. And also in each and all those my latest videos, I normally include my M-Pesa number, and I'm thankful for the send wave I received from United States of America, the $20, and I'm grateful for you supporting this channel from United States by sending Sendwave. I think my second last video, I shared the screenshots of the amount that I was sent, and this one really means that people mean well to us as family vlogs community. They want us to do more videos. The money that you people send is normally helping to build this channel in terms of buying for us bundles so that we can post videos without missing. Now, I'm still appreciating guys that have joined me. I want to invite some who are with me online, and I will be very, very happy. Our watch hours we are doing good. We are remaining with less than 1,000 to click that target, and it is because of your support that that we are reaching that place. Yes. Danke. Where is Danke? My year then in Germany. Thanks. In Danke. My geography is poor. Should I go Google it? Where is Danke? Huh? Where is Danke? Where is Danke located? This is in Germany. Huh? Or is it in Sweden or Denmark? Okay. My geography is poor. So, Judy, we will appreciate your donation, your kind donation. There's a PayPal button in those my videos, or you can even use Sendwave. Sendwave, you can send M-Pesa anywhere, anyhow in the world. United States, UK, USSR. You just download that application, connect it with your account, and you can send money to support PAMLI vlogs, and we will really appreciate. And we are continuing appreciating the last donation that was sent from US, and we are very, very happy. Now, today is the last day of February, and we had a target of monetization in March. Monetization in March. Those who really love this channel, there's a playlist called All My Videos. All My Videos. Click that playlist into tabs. Leave it running. It contains videos that are over 72 hours. So if you turn it, it will run for 3 days, because I have 112 plus videos in my channel, including the live ones. The live ones are very long, and they will manufacture these hours that are remaining, so that the partner program for YouTube accepts my application, so that hizo dollars zianze kukuja nyingi. Zinakuja chache, but accepting will make them now see that we are serious with this YouTube business, and those advertisers now, they can start looking for us by placing the advertisements in our channel. So PAMLI Vlogs, together with PAMLI Vlogs management that is managing my channel, is so grateful for what you people are doing in terms of watching our videos, in terms of supporting us, in terms of commenting in each and every video we post. Now, the reason why I said I want to choose, there's a question that bucket list asked, and I feel that we should continue discussing that. Bucket list asked a very nice, simple question that if you would start a foundation in the medical field, what will it be? So foundation in medical field is very, very important, and I chose two. And the first one that I chose was to start a foundation dealing with gender-based violence. I do research a lot, and I have several documents like this one. You can see this is a trainer's manual about gender-based violence, and this is that for quality assurance. These are for quality assurance for gender-based violence. Also, we have protocols that I have in software for adolescents, adults. Those are softwares that I have in my PC. And if I were to start foundation and with a support, then I will start one, dealing with gender-based violence. Mostly what is being reported is physical or sexual violence, but there is nobody reporting what we call emotional violence. There's nobody reporting emotional violence. Emotional violence is normally there in the society, and if somebody is neglecting you, if you are a female, somebody is talking ill of you, somebody not want to support you, that person is giving you emotional violence. And I would like to chat more about this in terms of videos that we are presenting. So I have also series of gender-based violence, and I would like you people to watch those particular videos on gender-based violence, and I will really appreciate what you people have done to this channel. I sometimes go overboard and talk about online business and business stuff, and I talked about some of the online business that I do, and one of them was Gram Free. I told you how much Gram Free paid me last time, and how much we are expecting from Gram Free. Normally, people are not understanding what this gram free is all about. Now I'm starting online business, and payment normally is done via PayPal. And in this my channel, I've done a lot of videos to do with how to open PayPal account, how to link PayPal account with M-Pesa. So because M-Pesa is the major, we call it a small bank that is, we can even operate by a phone and can get that bank anywhere, anytime. Now, if you have not watched my videos about PayPal and about how to link PayPal with M-Pesa, kindly go to my channel, watch it. Gram free will pay you when you do small tax. The last time I told you I was paid 123,000 Kenyan shillings, and now I'm expecting 180,000 Kenyan shillings. So the small tax that you normally do is just, if you navigate through the dashboard of Gram free, it is self-explanatory. You will roll 5 times a day. You just click the button roll. You will watch videos, and also you will be able to sign contracts. There are 4 contracts that you sign daily, and signing those contracts, if you sign risky contracts, you get a positive 7 plus a 0.7 of gram, and if you sign a normal contract, you get 0.3 of gram. So me, I like signing risky contracts so that you grow our channels. If you have not watched my 2 videos about gram free, no, 3 videos about gram free, kindly click the links that redirect you to my YouTube channel and watch those videos. Gram free is not a scam the way people normally think. It is the truth. It is the truth. It pays. So let me invite more people to come to this live so that discussion can be very, very attractive. I'm happy for the 6 guys that are with me, and they have not moved an inch, even the time I told them to stay. Kindly watch this, join me live. Let me just send them. So if you join me live, I will bring you to the screen, and we'll start discussing again. So let me post this. Let me post this to different types of guys in groups so that you can make this discussion to be very, very lively. So kindly a minute. So this joining me live should even have a StreamYard link. Okay. Should have even a StreamYard link. Okay. Yeah, should have a StreamYard link. So StreamYard link is there in my chat button, and it's a very fast one in discussion link. So let me just bring guys here, because they are very important. Come on, come all, join me. So guys, okay, yes, 7 with me, and I'm still inviting some to come for this. Click the StreamYard link, and if you click the StreamYard link, it will redirect you to my channel. So I tried posting StreamYard link here. Yes. Okay. I like this because I want them to come aboard through StreamYard link. I'm just sending them the link, so be patient. Some people would like to join us. They can't join because they don't have the StreamYard link. So yeah. Join me live. Join me live via this. Yes, it's sent. Okay. You click this and it will redirect you. I've sent the StreamYard link to my supporters, and I would like them to join me in the discussion. Let me bring more people, more guys. There are 5 staying strong with me, and these 5 are very, very important in terms of discussion. Now, we had discussed about issues. People were throwing questions here and there, and we were replying those particular questions kwa uwezo wetu, and people have been interacting with me well, except that sometimes I go and attend some issues. Now I'm happy that guys who have been with me from the beginning, it is now 4 hours sitting down and blogging. So you come on board, I will invite you to the screen. Just give me a minute. Okay, give me a minute. Okay, we are still strong. Okay. 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 Yes, almost done. Yes, guys. The StreamYard link is here. So now I have guys that are coming shortly. Then tell them to join me live. Then say join me live. Join me live. Yes. Link sent. Those who want to join me live can join through this. And I'm very happy for those who are now with me and watching. We want to say that what we are doing today is a very simple one. We are just doing what we call medical discussion. We are doing medical discussion, and we are just chatting. Let's chat. Let's chat, and in this kind of chatting, we are inviting questions medically related, online business related, and kindly like the video, give the video thumbs up, give the video thumbs up, give the video thumbs up so that we are able to continue with this discussion. Well, give the video thumbs up, give the video thumbs up. And if you are watching us today, kindly join this. And joining us means that we are bringing you in the screen. We are bringing you in the screen so that let me just share this. Even share with my guys via Facebook. So people are coming. I want you people to post questions. Post any question. Post any question. Post any question. Post any question related to this discussion. Post any question that is related to this question. And I would like you people to share the link. Share the link to you guys. Share the link. Let me take this call. Down. And here a market of 320, 228.8, 228.5. Ini here tablet market. Benjamin milligrams. Guys, this is now. We have this PAMLI Vlogs is presenting to you that this will be our design t-shirts, and we'll print many and give our subscribers. So when you are watching, know that the most subscribed people will get a t-shirt, and this one will be very, very vital in terms of helping us to move this channel. So PAMLI Vlogs is encouraging you people to be with him in terms of joining the lives. Yes, so sometimes we might interact with other people, and where is Mwendokasi FM? Where is my group members? So let me tell them I'm live. Sometimes they do not know. Okay, I've already told them. Yes. Thank you so much for maintaining this. And we are doing 2 hours strong. We want to do this for 3 hours so that I go and sleep a bit. Continue watching, continue watching, continue watching. Management has said you continue watching, continue watching. And it will be very, very vital to us in terms of managing our channel. So guys, so PAMLI Vlogs is encouraging you people. Oh, was taking the aim in terms of joining lives. Eugene, who can now bring me soda? You talk until your mouth run dry. Yeah, yeah, that is the essence of vlogging. You talk. Yes. Welcome. We are vlogging live. You can join us. You can click. You can even greet people online. Yes, you can greet people online. We are doing this live. Can you come and greet people? Yes, it's live. We have been interacting with the people here, and we have 6 watching. People have been interacting with me. From now, we have been here for 2 hours. As you can see, these are interactions. People have been, in fact, the discussion was revolving around hypertension, diabetes, gender-based violence. People have been here. Now 6 are with me. There's a link, there's a StreamYard link. If you go to that channel, you just click that link and I will bring you the screen. This link, if you click it, this StreamYard link, if you click that link, you will see yourself in the screen. If you are not familiar with this, you can ask me questions. So you can come. Hey, I'm still live. Yes. Okay. So we are still live and we are still happy. We are still pushing on. And I love you people. PAMLI Vlogs is loving you. Our main goal here today is to achieve, just to chat with you guys, and also remind you of this thing that is going on down there. If you are not busy with watching, you can do that. People are also sending messages. Hi. And you can also come by StreamYard link. Let me see, I've sent some link to somebody. And they can also join us so that we keep the discussion rolling. As I've told you now, we've upgraded and PAMLI Vlogs. So, people, it is very, very important. You can join me online. Yes, join me online for meditation, for group discussion. Yeah, Homa Bay County Teaching and Referral Hospital. Yes, somebody is asking me which school am I vlogging from. I'm not vlogging from school. I'm vlogging online. I'm not a student. I'm vlogging online from County Referral. And if you want to come to the screen, click that link of StreamYard. Just look at the comment section. There's a link on for StreamYard that is there. Just click that link and you will be able to come to the screen. And once I see you, that is the link of StreamYard sent. On the comment section, there's a StreamYard link that will appear on the comment section, and kindly click that link, and that link will redirect you to the screen, and we will be able to. Okay, join me live. Join me. Yeah, somebody wants to join me here. Yeah, somebody's still calling me, and I'm still live. Cannot able to receive because of me blogging. So just keeping my watchers on the standby. Kindly give the video thumbs up. Give the video thumbs up. Like the video. Like the video so that the discussion can continue. So I'm very happy for that. And when you join me live, you'll be able to if you join me live, you'll be able to support this particular channel by increasing our number and also increasing our yes. Okay. Okay, I'm live presenting. Live presenting. Yes, so guys, I said that there is a StreamYard link that if you click, it will redirect you. The topmost first comment, there's a StreamYard link that if you click that link, it will redirect you to my channel, and you will be able to join me live. And this is very important. And if you do not want to join live, you can play this via background the way I've said it. And I want to tell you that we've discussed about things, and these are what we are targeting. We are targeting this. We are targeting that 4,000 watch hours. You can play this in the background. Also, if you have not done that, you can subscribe. Family Blog YouTube 7. You click the link provided. Yes, this is my colleague. Welcome to the channel. You can click the StreamYard link and join the discussion. How can we handle such kind of issues? Georgie, there is somebody requesting something here, and I even don't know that person. I'm telling that person I'm live now. Can you read that message? It's so funny. Imagine that.
That's just fun.
Yeah? Very funny.
You don't know the person.
I don't know. You are funny. You are funny. I don't do such kind of stuff. I don't do such kind of stuff. I'm a family man. Somebody wants me to. Yes. Somebody. Kindly, if you want to join me, make sure that there's no background music because we don't want strike. Let me add you to the screen. Oh, check your camera, my friend. Your camera, I've added you, but your KGHBBBB. Your camera is off. Your camera is off. I don't know whether your volume is on. Your camera is off. Make sure your camera is on for you to see. But there's also a voice message. There's also part of voice. Enable it so that if you join, you will be able. I will be able to hear what you are saying, and we'll able to stream it. There's somebody who wants to join, but the camera is off, and the camera is off, so we cannot able to to bring him or her on board. So thank you so much for being with me throughout the channel, and that person that was distracting our attention has been blocked, so we can continue discussing, and those who are online can come. So I was saying that today is a day that we don't have a specific niche that we are presenting, or a specific this is what we are doing today, the one that is flickering below, and it is just joining PAMLI Vlogs live. Let's chat. Chatting, talk. You can ask any questions that you want or you need, and with doing that, we can be able even to bring you on the screen so that you talk to people, so that you talk to guys, you present your case. So let me review one video here. We talked about danger signs during pregnancy in one of our videos. That one I talked about. Also, let me welcome you again. It is long since I welcomed you. Yes.
What it is?
Yes. Somebody wants me?
Yes.
Nan? Are you seeing I'm live? Are you seeing I'm doing live? You can also join us and introduce yourself to the community. We are doing medical discussions, and welcome to PAMLI Vlog. Look at the nani medical. I bring prescription. Which one? Roman or Mag? Huh? Oh, okay. Do you know we are live? That one nobody has had. It is between me and you. Yes. So we have some three watching. The network is going down. So let's just jot to. We said we want to vlog for 4 hours. 2 Nini. Thank you so much, William. William, thank you so much. You can join us via the live. You can join us via StreamYard that I've just sent to you, and you can say hi to people. I know you are watching, and just click it and join us. I thank you so much for your time and for staying with me in this. And everybody who wants to join me can do this via StreamYard, so that or you can comment, you can throw your comment in terms of the charts that we said. It was medical charts. Let's chat. Don't fear the camera anyway. Don't fear the comments. Don't fear the. Mhm. Don't fear the camera. You are busy. I'm replying some people here, asking questions via the phone. I'm also replying some mails, and the same time, I'm also blogging with you. Hey, this guy is a jack of all trades today, and we want to do it for the sake of the watch hours that we need. So, my fellow tubers, this is a journey, and this journey is what we call what you are seeing down there, the journey of 4,000 miles. The journey of 4,000 miles. Every YouTuber knows this journey of 4,000 miles in relation to monetization. So you can even play it on the background, and this one will really help us. Yes, this is very important to us, and the one flickering road to 4,000 silent blog. You can silent it by a background so that you promote this guy. We are happy we are ending January, but it is so sad we've not seen our salaries for 3 months. But we are pushing life, and we are enjoying when we end this February. We want to end it when we've achieved some hours. Now, let's see. Let's read through YouTube Studios. How many hours are we remaining with? Let's see. How many hours are we remaining with? Let me just do some writing. Can you speak to people? Mostly. Iwu chidong ne wacha kocha.
Donc, je connais bien.
Wacho ni magilo.
Ma biro ibingi no kwa kachango ni to biro kon kachango ni to biro kon nyaka chiemo kon ibingi.
Okay, we are doing well. That's my colleague anyway, so do not worry.
Push beber guecho. Mondo bokane di maber, comfortable maber.
Indola. Oh, we are very sorry for that volume that was lost. We've rectified, the management have rectified that. Now, we were talking about, I was checking, right now I'm in the YouTube studio, and I want to check how far have we gone in terms of watch hours. This is where we are. Okay, let me see, zoom. You see, that is why we are struggling so hard. This is where we are, my people. This is where we are. So that is where we are. And what does that mean? What does that mean? So it means that this is what we are remaining with to go. This is what we are remaining with to go. 838 hours times 60, 50,280 minutes to go. Will we do it as per what is required? Remember, we are to get monetized by March 2020, by 2021, March 2021. So, guys, that is what we are remaining with, and I'm requesting you to support this channel so hard. Support us so hard that by playing our YouTube videos, by liking, by subscribing, by sharing, by telling each and everybody that PAMLI vlogs exist, so that those 838 hours remaining, we beat them. And if we beat them, now that we will now enjoy. So this is how I do it. This is how I do it. This is called PAMLI Vlogs Book of Management. YouTube is business, so we normally record everything that is happening. This is how we do it. These are watch hours. These are watch hours. This one. These are watch hours. And as you can see, let me start by the month of February. Videos balance brought forward was 2,337. So 2,337, and now we are doing today at ni amoxiclav, hydrochlorotrimazole pessaries. Oh. Fluconazole. Let me change. Are they more? 1 week. Now let's see where we are now. Let's see where we are. That's a colleague I'm helping. We are at 3162. So we update today, the end of the month. We are closing February when we are at how many subscribers? We are at 2,550 subscribers, and watch hours we are at 3162. We are at 3,162, and previously 3162. By yesterday, let's see the hours we added. Yesterday we were 3104 minus 3162. So it means that we have added 58 good hours. 58 good hours. 58 good hours. So we are closing the month of February when we have 2,550 subscribers and 3,162 3,162 watch hours, and a balance of 800 and 838, 838. So we want to struggle with this balance of 838 so that the month of March is our month of monetization. Please, guys, this is the month of monetization. Kindly play the video background. Kindly play our videos, watch our videos, like our videos, share our videos, so that we click this balance that we are seeing. This balance of 838. So that is the balance to go to monetization. In fact, the last time I vlogged, this was, we had 1,900 and 1,400 hours to go, and we had achieved 2,580 hours. That one now is going to change. That one now is going to change. It's going to change because now we have 838, 838. Let me see one just to change. We have 838 to go, and achieve is 3,162. So let me show you that. Okay, errors occurred while save. Okay, I can't save, so I just say that. So we have 838 hours to go with those ones. So those who want to join us can join. You can see 2 watching strong. I want to leave you a bit, a very short break as I check something here, so that this discussion flow like an oil, It is 2 hours, 58 seconds, 58 minutes and 30 seconds. Let me update. Thank you so much, people, for stay with me. Went off. Fully went off. So let's do it. Let's continue. That if you click It will redirect you. The most first comment. There's a streamer link that if you click that link, it will redirect you to my channel, and you will be able to join me live. And this is very, very important. And if you do not want to join live, you can play this via background, the way I've said it. And I want to tell you that we discussed about things. And these are what we are targeting. We are targeting this. We are targeting that 4,000 watch hours. You can play this in the background and also
Hi everyone.
You can subscribe. PAMLI blog. Click the link provided. Yes.
Hi
This is
everybody.
my the channel. You can click the stream link and join the discussion. There is somebody requesting something and I don't know that person. I'm telling that person I'm live. So, but imagine that. Somebody wants me. Yes, somebody. Kindly, if you want to join me, make sure that there's no background music because we don't want strike. Let me add you to the screen. Oh, check your camera, my friend. Your camera, I've added you, but your HGHBBB. Your camera is off. Your camera is off. I don't know whether your volume is on. Your camera is off. Make sure your camera is on now for you to see. But there is also a voice message. It's also part of voice. Enable it so that if you join, I will be able to hear what you are saying and be able to stream here. There's somebody who wants to join, but the camera is off and the camera is off, so we cannot able to bring him or her on board. So, thank you so much for being with me throughout the channel. And that person that was distracting our attention has been blocked. So, that continue as those who are online can come. So I was saying that today is a day that we don't have a specific niche that we are presenting or a specific, this is what we are doing today, the one that is flickering below. And it is just joining public blogs like let's chat. Chatting, talk. You can ask any questions that you want or you need. And with doing that, we can be able even to bring you on the screen so that you talk to people, so that you talk to guys and you present your case. So let me review one video here. We talked about danger signs during pregnancy in one of our videos. That one I talked about. Also, let me welcome you again. It is long since I welcomed you. Yes. Okay, great. Yes. Somebody wants me. Man, are you seeing I'm live? Are you seeing I'm doing live? You can also join us and introduce yourself to the community. We are doing medical discussion and welcome back to the okay, you know me, jadi nani? Nani magela? Nani mati bosya? I'm back. So, there is a question that one of us has asked, and this is what now will form the discussion in the afternoon. I think we are now from lunch, and we can be able to discuss this without. Can be able to discuss this. So, Duncan Owino is asking. Sorry, was busy. Is there a way of resolving ectopic pregnancy without going to theater? Is there a way of resolving ectopic pregnancy without going to theater? First of all, let's understand the process of implantation and the process of fertilization. Now, what normally happens? Anterior pituitary gland normally releases two hormones, that is follicular stimulating hormone and luteinizing hormone, after being sensitized by gonadotrophin releasing hormone from the hypothalamus. And this will normally act on the ovaries for development and maturations of ovarian follicles. And then this maturation, there will be ovulation. When there is presence of sperms, then fertilization will occur at the fallopian tube. Now, ectopic pregnancy, after fertilization, around 6 days, implantation will be taking place at the uterus, the uterine wall, that is endometrium. Now, how ectopic pregnancy now, implantation of this particular ovum, the fertilized egg, into the fallopian tube, then that is outside the uterus. Now, the fetus will continue developing at that particular place, and eventually, because it's a narrow tube and it is very, very small, by the time fetus will start development, it will make that place to swell and eventually burst. So sometimes it is very, very impossible to for this thing to resolve by itself. It must be taken care of in the theater. This is simply because when it ruptures, it will continue bleeding, and you will bleed internally, and you will develop severe anemia, severe abdominal pain, or severe pelvic pain that might even result into a neurogenic shock because of this pain, even if we are now forgetting about the shock due to you've lost a lot of blood, that is hypovolemic shock. So sometimes, my friends, you ask a very nice question that is very, very necessary. But for now, for this particularly when we have the tubal ectopic pregnancy, it is very difficult for it to resolve. Except those who normally abdominal ectopic pregnancy is very rare. Sometimes they resolve, but sometimes some need surgery. But the one that implantation on the fallopian tubes or the tubes is really difficult to resolve by itself because of that narrow fallopian tube, and this is now how we take care of this. Of course, you will be taken to theater and surgery will be done. So, Duncan, I know I ask you, you asked this question and I didn't see it, and now I've answered you. So welcome to PAMLI Vlogs, and we are still discussing about any question that somebody might throw or somebody might post. We had very many questions that we had discussed about, and most of the questions, first of all, we started by discussing that one appearing on the screen, and we talked about it very, very well. We also went ahead and did that one. The discussion was very, very vital and important. That question was about family planning, and also we talked about that high blood pressure and hypertension. Also, we did some few about blood donation, and also we talked about transfusion reactions in details. Also, we had a question about children disappearing from maternity versus doctors, clinical officers, nurses to be trained. We talked about that forever. And down that last one, I've talked about the Dwayne Khan's way to solve ectopic pregnancy without going to theater. So the discussion is still strong, and I want you people to know that we are doing what we call just chatting, chatting, and that is what we have posted there, the screen, and that is medical discussion. Let's chat, and also you can support this channel by during several occasions. Now, thank you so much for those who have been contributing and those who have been making this PAMLI Vlogs live chat. Let's chat to be very, very lively. To be very, very lively. Now, I want to say something that I just want to brush it, but there will be a brand new video that will be we talk about in terms of this particular book. And this one, I just want to encourage our women in one thing. There's a page that most of the women normally regret when they bring the child to. I will make a video on child welfare clinic, or child welfare, the medications and the vaccines we give during immunization period. But now this is a challenge to our women in terms of attendance of clinic. Yes, if you can see the child welfare clinic, the vaccines normally go up to around 9 years, around 9 months, sorry, when they receive their measles, and after that they disappear. They disappear for good. Around 18 months, that one for rubella, and 9 months for the normal measles virus, the vaccine at 9 months. Now, after that, they normally disappear for good. They don't even bring children for weighing. They don't even bring children for vitamin A. They don't even bring children for deworming. So I talked about worms and the dangers that worms pose in one of my videos. And I said that only children are normally considered to be dewormed, forgetting even adults, and even adults pose greater risk of having worm, just like children. So a child should be able to attend a child clinic until 5 years. So this book, I normally told you in further support that this book we should be handing it over to our child when he's adult. So those who are normally leaving their children at home from 9 months should not be there. So even vitamin A we should be giving up to 59 months. So please take care of this. 5 years around that time. 5 years exactly 60 months. So we go up to 59 months. That is taken care of. Any question? Any question? If you have a question type. Yeah, some two questions have arisen. Two questions have arrived. Uh, some questions have arrived. Now, Dwayne has post has just written that she's thanking me very well of the question that we talked about, and I'm very happy that he's happy about that question that I have tackled, and I'm very happy that you are happy about the questions that you've asked. Is there any at what? Okay, there's another one. Anybody online before I answer this? What is the late age of detecting sickle cell disease? This one you will be able to answer me. Eh? Dwayne, you will be able to answer me. You'll be able to answer me because this is your line of profession. This is your line of profession. Huh? This is your line of profession. This is your line for profession. So we start detecting as early as early. There are some tests that detect even carriers as early as first day of life. Even me, first of all, when the research that is being done by AMPAT and Cambridge CDC, my child was tested at the very day she was given birth to. So, and I was told that she's free of it. And in that scenario, we also informed that you can detect that as early as you can know that this child is a carrier as early as day one of, of the visit. Now, what was your question? What is the late age of detecting sickle cell? So, is there anybody around so that I can do the answer? Anybody around? I'm seeing how many people. 6 are watching. 6 are watching. Any contribution from any medic? You know, adults are always right. So even if you answer, even if you don't answer correctly, we'll be able to give you a nice, correct answer. But before I do that, is there anybody around that wants to say something? Because I'm seeing people are watching here. And how many people are in? There are five in the mix. 5 in the mix. 5 are watching. 5 are watching. Anybody? Anybody?
Aye, ingine tu muhimu.
Mpeleke Nyariki.
Dingeng.
Just leave me first. Let me finish what I'm doing first. It's too late. Oh yeah, what happened to the camera? So we must start. What is the latest age to detect? Latest age. Latest age in terms of the first age or latest 12 months, 12 years, 5 months. That is the early beginning when you can detect the sickle cell traits and the sickle cell disease. Of course, HB electrophoresis is very key. But 12 years, I think, is the latest that you can detect this. If I'm wrong, you can post that and update us. So let's go on. Let's go on with the live. So guys, I'm going to mute the camera. I'm going to mute the voice. I'm going to break for lunch and come back for afternoon session. So keep watching, or you can leave it to play background. So what I want you to do, let me put the banners so that you can know what we are doing. So you can leave it play background, and we join the next class in the afternoon. Sawa sawa. So remember to do that. Okay, play it in the background. Okay, yeah, play that in the background. So I'm muting everything. Stop